في الأول طبعا شكرا دكتور أماني على التقديم الجميل ده، ومعلش انتوا هتشوفوني كذا مرة، فده الكيس برزنتيشن ومودريتور، فاللي هو الاثنين يعني. هو دكتور سامح صراحة طلب مني ان انا اقدم كيس برزنتيشن سيمبل وفيها بس مسج فور جنرال بيدياتريشن. يمكن التايتل بتاعي شبه منى شوية simple but our case today is about 7-year-old boy presented with an attack of supraventricular tachycardia. He was managed in the ER and he returned back to sinus rhythm. He had a previous history of palpitations. CBC was done before revealing anemia, and he was diagnosed as iron deficiency anemia, received iron supplements, but with no improvement. He was complaining of fatigability and exercise intolerance. He lost about 5 kilograms in about 2 months. Of course, the cardiology department saw him and he just said it's just one attack of SVT. He made an ECG and echo, and he was excluded to have any cardiac problem. Now he went to another doctor, and of course, with these symptoms, he was afraid that this patient may have a type 1 diabetes. So he did a fasting blood glucose level, but it was 85 milligram per deciliter. He was also complaining of pain in his eyes, and the ophthalmologist diagnosed him as having keratitis and prescribed eye drops for his keratitis condition. Now, what is missing in this boy? Can any one of you say what is missing in his or investigations or examination of this boy? Maybe complaining of palpitation, SVT, loss of weight. Yes, thyroid. So what is missing? Of course, we are in endocrinology session. That was missing in the clinical examination that this patient has goiter. So we have to check for his neck for any neck swelling. The thyroid functions revealed that the TSH was low with elevated free T3 and free T4. Autoantibodies was done revealing positive anti-thyroglobulin antibody with positive anti-peroxidase, but normal TSH receptor antibody normal traps. Ultrasound was done, revealed that both thyroid loops and isthmus were enlarged, normal homogeneous parenchyma of the thyroid with evidence of increased vascularity by Doppler. So to reach our diagnosis by the clinical and the thyroid function test, ultrasound, and autoantibodies, our final diagnosis was autoimmune hyperthyroidism. If any one of you know this film, it was about few years ago. It's called HEPTA. It was about the 7 stages of love. Actually, HEPTA means 7, and I love abbreviation. So I think, what about the HEPTA of thyroid? Because the word thyroid contains of 7 letters. So first of T, so you have to think, because this is the proverb of endocrinology. The eyes are useless when the mind is blind. You have to think first before doing the investigation. The H of history. So remember this Snow White and the 7 Dwarfs, because we will talk about it in the summary later on. Why? It's about, yes, it occurs. If you remember that the case with the boy, as you all know, thyroid diseases is common in females, but don't forget, yes, it can occur also in males. The R, you have to recheck. You have to recheck for the thyroid and keep calm, and you may have to blame your thyroid for your clinical manifestations. O is the out of control. So whatever you have any out of control of your symptoms, you have to think of thyroid functions, either tiredness or nervousness, brady or tachycardia, either weight gain in hypothyroidism or loss of weight in hyperthyroidism, hypothermia or heat intolerance, either GIT disturbance, constipation or diarrhea. In females, if you have irregular menses or menorrhagia, dry skin or sweating. The I is for immune. Of course, most common causes of thyroid diseases is an autoimmune disorders. And finally, the D for diagnosis. And here we can complete the HEPTA of the thyroid, and we reach the diagnosis finally by stepwise approach, as we done in these cases, by clinical TSH, free T3 and free T4, autoantibodies and thyroid ultrasound, and may, in some cases, we need to do iodine uptake or fine needle biopsy in cases of thyroid nodule. And finally, thank you. بس السلايد بتاعت ثانك يو كانت فاضله. اوكي